One of the things I've been talking about for a few weeks now is what I see as the underselling of the coronavirus vaccines as something that could well be making people less interested in getting vaccinated. When you see endless headlines about even if you're vaccinated, you can't do anything differently. You can't hang out with people. You can't do indoors. You have to wear a mask. You can't travel. You can't visit anybody, all of this different stuff. And we've been expecting new guidelines from the CDC in conjunction with the dramatically accelerating vaccination numbers that we talked about yesterday. And we got it. The big news, to skip to sort of the meat of the announcement, is that the CDC now says vaccinated people can safely gather indoors without masks with other vaccinated people, without social distancing. You can hug. Vaccinated people can also be with unvaccinated people if the unvaccinated people are of low risk. And there's a few other things. Let's look at CDC Director Walensky telling us this yesterday.
CDC recommends that fully vaccinated people can visit with other fully vaccinated people in small gatherings indoors without wearing masks or physical distancing. Remember, here we are talking about private settings where everyone is vaccinated. So what does this mean? If you and a friend or you and a family member are both vaccinated, you can have dinner together wearing masks without distancing. You can visit your grandparents if you have been vaccinated and they have been too. Now, I want to talk to you about another more complicated scenario. It involves vaccinated people visiting with unvaccinated people. When fully vaccinated people visit with unvaccinated people, we have to consider the underlying risks of the unvaccinated people and any unvaccinated members of their household. We take this approach because all of our guidance is rooted in making sure we are keeping people safe. So, CDC recommends that fully vaccinated people can visit with unvaccinated people from one other household indoors without wearing masks or physical distancing, as long as the unvaccinated people and any unvaccinated members of their household are not at high risk for severe COVID-19 disease.
So additionally, vaccinated people can gather indoors unmasked with unvaccinated people from the same household, assuming that the unvaccinated people are low risk. So the point here is the vaccines are extremely effective, essentially 100% effective at preventing serious COVID and death. And they appear to reduce transmission. More on that in a moment. And on this basis, it is time for certain elements to start going in the direction of renormalization. Now, vaccinated people should not go hang out with a high-risk 85-year-old unvaccinated person. Fortunately, increasingly, a majority of those over 60 have now been vaccinated, at least with one shot in the United States, majority, not all. To put it a different way, vaccinated grandparents can visit unvaccinated healthy kids and grandkids, but vaccinated kids should not be visiting unvaccinated grandparents. I will be paying very close attention to this household thing. Being vaccinated myself, my girlfriend being vaccinated, I have friends who are couples and work from home who aren't yet vaccinated. That seems safe, and that's in accordance with what the CDC says. Two couples from different households, especially if one doesn't work from home, I'm not going to get into that kind of situation for the foreseeable future. So this is a big step forward. The science seems increasingly clear on how effective these vaccines are at preventing death, serious illness, increasingly clear that they also reduce transmissibility, although that's still being studied. The CDC said yesterday, a quote, growing body of evidence suggests people who are vaccinated are not only less likely to have asymptomatic infections, but also potentially less likely to transmit the virus. Still, they aren't ruling out the possibility that a vaccinated person could inadvertently transmit the virus. We're going to learn more about that over the coming weeks and months. Also from the CDC yesterday, vaccinated people don't need to quarantine or get tested if they have a known exposure to the virus, assuming they don't develop symptoms. So this would be you find out someone you work with, if you're working in an office, someone you work with has tested positive. you are vaccinated. You do not need to go through an isolation and quarantine protocol if you are vaccinated, unless you develop a symptom. Vaccinated people should be avoiding large and medium gatherings still. Everybody should. And of course, none of these guidelines change anything for vaccinated people out in public. If a grocery store says masks, then everyone wears masks regardless of vaccination status. That should be obvious. That makes absolute perfect sense. So hopefully, and we're going to have a very interesting interview later today with Jonathan Berman about the vaccine hesitancy, which is fortunately waning in the United States on the COVID vaccine. Hopefully this increases the number of people who get vaccinated, since the more that do get vaccinated, number one, the more people that can get into this new protocol outlined by the CDC, but also the faster we can go to the next step of relaxation of guidelines. Now, some states are just relaxing all guidelines now, Texas, Mississippi, some others scheduling further relaxations, going to wide open everything, no masks anywhere. I believe that there will be people who will want the vaccine because now it's in black and white from the CDC. You get vaccinated and your parents do, you can hang out and you can hug. And these are things that many people in parts of the country haven't done for really almost a year. We're about a week from the 1 year mark from the Trump announcement that travel from certain countries is being banned, and sort of the beginning of quarantines for those who have been doing them. That's what's going on in terms of what vaccinated people can do. Let's now go to our weekly COVID update as to the numbers, which continue to improve, fortunately. If you are anything like me, you probably aren't thrilled with the idea of going into a doctor's office right now. And thankfully, there's a practical and affordable way to take control of your health and get personalized care from the comfort of your home. It's a service called SteadyMD. They're one of our sponsors. You take a quiz, you get matched with a licensed primary care physician who understands your health needs. You have a 1-hour video call with your new doctor. You establish a meaningful relationship with them. And after that, your doctor is available to you anytime by text, phone, or video chat. This is not a random doctor on call. Each doctor at SteadyMD has a limited number of patients, so they actually have time to listen to you. You get the personal attention that you deserve. They can do almost everything an in-person doctor can do: perform medical evaluations, talk to you about health concerns, send prescriptions to your home or local pharmacy, and anything they can't do online, they'll quickly set you up with an in-person provider to do, things like blood tests, as an example. You don't need insurance. It's only $99 a month with no other fees or copays. There are so many practical advantages to using SteadyMD for primary care, and it's also so much more affordable. Go to steadymd.com/Pakman to take the free quiz, see which doctor is right for you. I took their quiz. They matched me with a doctor who specializes in my particular health needs and situation. The doctor they gave me is a really perfect fit for me and my medical needs. There's no risk, no commitment to get started. Just click the link right underneath this video.